Hi guys, my name is Torie. I am one of Dolly's friends. She asked me to talk to you guys tonight about TPN, which is Total Parental Nutrition. I also have gastroparesis like Dahlia. Currently, I have a J tube and a G tube separately, and I also have a PICC line, which I use for my TPN. The reason I am on TPN is because it takes me a very long time to get used to J-tube feedings. When we started the J-tube feedings, I continued to lose weight, and I really needed some extra help. This is my second time on TPN. I was on it last year for about 3 months. It is used often for people who do not tolerate tube feeds for any particular reason, and it really helps because it is nutrition directly through the vein. TPN has saved my life twice now. Without the calories and the nutrition that it gave me, I would have never been able to heal from the surgeries that I've had. It's also really helped me to gain weight and to sustain a life outside of the hospital, and really gave me the opportunity to work on the J-tube feeds at my own speed, so I could up them at a speed which I was comfortable at instead of super fast like doctors want you to. Yeah, so that's my life on TPN. This is my bag of TPN. And as you can see, it actually has a script on it with the different, you can see here, amino acids, dextrose, sterol water. That's what makes up the TPN. Some people's, and I started out with lipids, which are fats, but like I said, due to the fact that I'm doing so well, I get to move just to the clear kind without the lipids. So now I'm going to actually show you how I prep my TPN. You really have to be careful when you're prepping the TPN. So the first thing you have to do is wash your hands. So what you're going to do is first, these are my vitamins. These are kind of like the multivitamins that you take in the morning. So you have to pop the caps off, and then you take your alcohol wipes. And then you scrub each one, even though they tell you, even though this is supposed to be sterile, you should still wipe it off just in case. You wipe that one off and you let it dry. Kills all the bacteria. And then you wipe the other one off. And then each week they send me my supplies. And this is just a syringe. You open up the sterile, and then you have to pull it back to let some air in. I usually go to the 5, and then you stick it in there upside down. You have to push the air up and then pull the needle out just a little bit so that it can fill up with your vitamins. And then you pull it back again, and then you put it in this one. Now, this one is, wait for it, yellow. So, the thing about vitamins, not that you can smell at home, but they smell kind of funky. And what I usually do is zip the hat back on. So this is pretty much the drug Prevacid. So what you have to do for this one is I have a needle tip here, and you open it up, and you open this up, and you just stick them in. So at this point, you people at home are probably thinking, hey, she probably went to nursing school. But no, normal people do this. They taught it to me, so now I know how to do it. So now, what I have to do is prep my bag. So I snap that open, and then, of course, I wipe it. Wipe, 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 wipe. Just in case. You want to make sure all places that bacteria could get in are clean. And then you take the needle, you stick it in there, and you add your medicine. And then these go in a sharps bin that they come pick up every once in a while. Scrub it again. And then you add your vitamins. And this one's always my favorite because, as you can see, it turns yellow. I always wanted them to, like, make it purple or something. So that is your TPN bag with all of your vitamins and your medicine. What I'm taking out is my cassette, and set. So this is pretty much like IV tubing that's specific for my pump. This is the CAD pump. And then you take off this part and you spike it. It used to be really, really hard for me, but like I said, I got the muscles. And then your TPN is all prepped. You take the set and you stick it in there. Ta-da! So now is everyone's favorite part of any tube kind of feed. You have to prime your tubing. And what priming does, as I start, it's kind of hard to do sometimes to hold the button down the whole time, is it gets all the air out of all the tubing. Because if you pump air into your line, you can get really, really sick. You can create an air embolism, which would be really bad. So, all done. So I would do all of that to prep my TPN bag, and then I would go get ready for bed, usually. So what a PICC line looks like. As you can see, it's essentially like an IV but the catheter goes all the way to your heart. And as you can see, I have a double lumen one. So on days if I want to do IV fluids and I'm prescribed those, I use the clear one, and the red one is for TPN. So you take, this is called a lumen, you take it, and you take the cap,
and you clean it up with 15 seconds. And this is just so you make sure, really make sure you scrub it, so when you're ready to
flush it, which I do twice a day, to make sure there's blood flow, or there's no blood clots and there's good blood flow into the veins. And a trick, I always forget to unclamp it, and I just push the saline through. And make sure there's nothing in there. Then I take the end of my TPN, or the end of the tube, take the plastic thing off. And then I stick it in there. And I press start. And that starts my TPN. Some people run it 24 hours, some run it 16 or 18. I run mine 12 hours overnight. So that way I just sleep while it goes on. And that is how I get a good amount of my nutrition and my fluids, is my TPN. So next time you're sitting down to a meal, think of me and me eating my meal. And think of how I would so much rather be eating whatever you're eating.